virtual program series that we're now doing. This is a new series that we adopted a couple of months ago. It's helping us connecting the MS community to valuable resources that are out there with the different multiple sclerosis patient advocacy organizations. And then also further on down the line in several months from now, we're going to have a few different research centers involved with this dialogue as well. So for tonight, though, I wanted to, just introduce myself. I'm Stuart Schlossman, president and founder of MS Views and News. A lot of you already out there already know who I am. Those that don't, you want to know, we'll save that for another time, okay? All right, so for tonight's program, we want to say thank you to our supporters. We have Bristol-Myers Squibb, we have Biogen, and we have Sanofi Genzyme. Yay, let's give them a virtual round of applause. Okay, great, thank you, perfect. And tonight we have our guest, Bari Talente. Bari Talente is the Executive Vice President for the National Multiple Sclerosis Society. And right now I'm just going to welcome Bari, and I want to ask her to introduce herself and let us know what she does every day and what your exact role is with the National MS Society.
Great. Well, thanks, Stuart. And hi, everyone. Thanks for having me. So like Stuart said, I am Bari Talente. I'm the Executive Vice President of Advocacy and Healthcare Access at the National MS Society. So I'm fairly new to the healthcare access role that got added onto my responsibilities back in the fall. But we did it in part because there's such a linkage between healthcare advocacy, healthcare access, making sure that people with MS can get access to high quality and comprehensive healthcare, that it seems like a natural fit for us. So my background is advocacy. I have a law degree by training, though I never did the private practice. I was always much more interested in how to change the world through legislation and public policy. And so that's how I landed ultimately at the National MS Society.
Great, thank you for that.
Yeah.
Keep going. I don't want to interrupt you. Keep going.
Day to day, I think what I love is every day is a little bit different depending on what's happening in the world. So the political scene, as you might imagine, takes a lot to sort of stay on top of. So there's lots of meetings with coalition partners, diving into public policy issues, talking to MS activists from across the country to hear their stories and see where we can plug them in. And then, we talk with a lot of partners too, partner organizations, pharmaceutical companies, some of the ones that Stuart mentioned as sponsors, other companies in the healthcare space, really to make sure that we're doing what we can to find solutions for people with MS and their families.
Great, thank you. So tell me, are you working from home during all this?
I am. I have been home since about March 16th. So with my husband and my kids and my dog, and it gets a little loud and a little crazy sometimes.
I was going to ask how that's working for you.
Yeah. So the 2020 Public Policy Conference, where we bring in about 275 people to Washington, D.C., was about the last event that happened before sort of the world shut down from COVID. So we were the first week in March last year, we had lots of people in D.C., and everyone left and things exploded. So yeah.
Sure did. More ways than one lately, right?
Yeah.
So that's another subject, all right? So let's get started with some of my questions, all right? Can you help define or explain for the audience what advocacy work actually is and why it's so important for the multiple sclerosis community as a whole?
Yeah, so this is one of my favorite topics. So I think, there's a thought that advocacy is like this big, complicated political beast that's out there. And really what I like to tell people is all of us advocate in our everyday lives. We just haven't named it that, and so we don't realize it. But if you think about sort of sitting with your family on Friday night when everyone's tired of cooking and wants something different, and these days you're ordering in, and everyone's sort of jockeying around what restaurant to order from, and everyone wants their favorite food, right? And so advocacy is really about education and persuasion. So maybe you're saying, well, let's try this new restaurant. I saw a 5-star review, right? And here's what it said, here's the menu. So there's education, right? Here's the menu, here's the facts about it. But then the persuasion part, I'd really love to try it. we had Italian last time, let's have Thai tonight. Whatever it is, that's the persuasion part. And so that's really the basics of advocacy. I'm sure if you have kids, they advocate on a daily basis to meet their needs. So we're really just scaling that up on a larger scale to meet our advocacy efforts. And so, it's so important to do that because we have to find solutions for people affected by MS, and we know we can't do it alone. It takes a village, and there's a lot of government resources and programs and funding that can help people with MS, and we need to make sure that they're positioned to do that. And so that's really where advocacy comes in, is sort of leveraging government programs, institutions, funding, all of that to make sure that people with MS have what they need.
Okay, great. Thank you for that. And that leads into the next question quite wonderfully. How do MS activists and the MS Society reach how do you have contact with the federal, state, and local level of lawmakers?
Yeah, so there's a lot of different ways to reach out and make those connections, especially now. And the MS Society helps to facilitate that for people. So we have an online email system where we send out emails to people through our MS Activist Network and say, it's time to contact your legislator about something that's really important. And you literally click a couple of buttons and an email gets sent. Almost every elected official nowadays is on social media too, so you can connect with them there. When we're having more formal meetings these days, they're much like this. They're virtual meetings where people are hopping on and looking at each other, or even some old school phone calls. So, the US Capitol, you can call a general number and get connected to any office, and they can help you figure out who your direct elected official is at any point. So there's really lots of different ways to connect. And it's just really important to sort of take that first step and make the connection. And when you're making that connection and reaching out, really taking that extra moment or two to personalize your communication. So as you might imagine, elected officials get a ton of communications. And so when they all look the same, like our action alert system, our email system might, they sort of try to lump them all together. But when you take the time to personalize that communication, just add a couple of lines around what it means for you to live with MS or why that particular issue is important to you and explain that to them, then your message is going to stand out and it has a greater chance of making an impact.
Perfect. Thank you. So before I go on, I want to let people know if you have any questions to ask that are relevant to or relating to what Bari and I are talking about, please ask your questions. You got to go at the top of the screen on the right side. There's an arrow. Just click on that and type your questions. But please do not ask anything to Bari that only a doctor can answer. All right? She just can't do it.
No.
All right. So next, what are some examples of advocacy successes for the MS community? And has there been anything in the COVID-19 relief packages to help people affected by MS? You could take those one at a time if you want.
Well, that's great because I have a lot to share about both of those. So let's start with some general advocacy successes first. So we have done really well securing federal funding for research specific to MS. So we're super proud of that. There's a special program through the Department of Defense where there's disease-specific line items is what they're called. And so that money is designated per the disease that gets that specific funding. So back in 2008, 2009, we were able to add multiple sclerosis into that program. So the umbrella name is the Congressionally Directed Medical Research Program, and ours is the MSRP or MS Research Program. So since its inception, I'm super thrilled to share that more than $90 million has gone to MS research just through that program alone. And, another great example of advocacy and sort of using that education I talked about is once we had the new prevalence numbers for MS, so once the data was published that there's now nearly 1 million people living with MS in the United States compared to the 400,000 we previously thought, we leveraged that information and did a big education and advocacy campaign on Capitol Hill. And we said, well, now there's more than double the number of people with MS that we thought. And so we have to do more, we have to do better. And so we were able to grow that line item funding, because it has to be specifically appropriated every year, from $6 million all the way up to $16 million in a single year. And then in 2020, we got that up to $20 million. And so this year in 2021, we'll be back to Congress and we'll be asking for $20 million again. So, that's one specific pool of funding that's specifically going to MS research. There's also funding through the National Institutes of Health and through the PCORI, the Patient-Centered Outcomes Research Institute. And both of those agencies fund a significant amount of research. So, there's lots on healthcare too, but let's talk about COVID for a few minutes. So, so we certainly know that people with MS and others across the country have been hit really hard by COVID. So there's the healthcare, the health aspects of it, but also the economic aspects of it. And so as we've weighed in across the country, and some of this has been at the state level too, and at the federal, we've really looked at what do people affected by MS need around healthcare from COVID, and what do people with MS need for economic relief? And so we've approached it from both of those standpoints. So for healthcare, we've advocated for things like funding for vaccine research, for the vaccine distribution that we're seeing now, health coverage and making sure that people can get the vaccine for free, and expansion of telehealth, which we've seen really take off during this time as people are staying home and don't want to go out. So all of those things have happened, and telehealth has gotten a really significant boost. So both funding for telehealth as well as for broadband access to support people that don't have good internet access but want to be able to see their healthcare provider in that way. On the economic relief side, a lot of resources for people with MS and everyone around things like energy assistance, rental assistance, and a moratorium on evictions. We've also seen an extension of unemployment benefits, more funding towards domestic violence prevention, and a lot more things like that that are now available for everyone. And that includes people with MS who are impacted at this time.
That leads to so many new questions. One of them, though, is, and that's something that always people hit me on, is how did the society go from 400,000 to 1 million?
Well, it wasn't the society. It was a society-funded group of epidemiologists.
Okay.
And so there's a few papers that have been published in peer-reviewed journals and a lot more information and explanation on the National MS Society website. But essentially that group of epidemiologists developed an algorithm, and they tested that algorithm to be able to look at healthcare records, and from the healthcare records and visits across the healthcare system, their algorithm pulled out people who have MS. So that included things like prescriptions or visits with a healthcare provider. So those were the type of things that were in the algorithm. So again, they tested it against some known data sets, like I think Rhode Island, because it's a small population, it's sort of known how many people with MS there are in Rhode Island, and Canada does a very good job. So they were able to test it across sort of known data sets to test the validity of the algorithm. And so then it was applied across healthcare systems. There's lots of things that happen, and I'm the lawyer, not the scientist, but that's sort of the basis of how they got to the new prevalence number.
Okay, thank you. With regard to people in remote regions of the United States that have poor internet to begin with, how is the broadband access program working for them?
Yeah, so I think, what's important to keep in mind around what happens when legislation passes, especially really big pieces of legislation. So the COVID bill and federal appropriations were joined together. It was like 6,000 pages. So it sort of sets out the parameters of the program, and there's funding. And then over time, the program needs to be built out, often through regulations. And so, just what we saw in the legislation isn't the end point of it. And that the latest COVID relief just passed at the very end of December. So, that's something that it's important to keep an eye on those types of programs and continue to advocate that advocacy shifts a little bit from the congressional level to the regulatory level to make sure that those programs are getting implemented in a way where they're actually helping the people that it was intended to help.
Okay, great. Thank you for that. With a new president and a new Congress recently sworn in, what can we expect?
Yeah, it's a big question, right? So we have a president coming in, pledging unity and trying to bring the country back together. We also have very close margins in Congress. So what we know is that bipartisanship will be really important. There's going to need to be agreement between Democrats and Republicans to move a lot of things forward. We also know and can expect that COVID is top of mind and that the next few months will be probably primarily focused on COVID relief. So ramping up vaccine production and distribution as much as possible. There's talk around another economic relief package for COVID. President Biden has also talked a lot about healthcare. And so we're expecting to see movement on some healthcare issues, maybe some smaller things to shore up the Affordable Care Act, which of course became law when Biden was vice president. So we're expecting a few things around that, but it'll probably be quite a few months before we move beyond COVID and some of these smaller healthcare things.
Okay, great. Thank you for that. Now, what are some issues the MS activists are looking to address at this time?
Yeah, so, like I said, I think we'll keep weighing in on COVID relief, some changes to healthcare, access to medications. We know that MS affects people and families in so many different ways. And so we really address a lot of different issues through our advocacy. So some of it we're looking at proactively, and some of it is based on opportunities that we see that come up. But I think, the new administration has to get in place and determine some of their priorities as well. But we're definitely focused in on a lot within the healthcare space.
Okay, thank you. And before I go any further, I want to let everybody know that there is a handout that if you click on where it says handouts, there is something there that Bari is going to discuss later on, but I don't want to forget because I might. So I wanted to just mention it now. Yeah. And now I won't forget because I said it, okay? I won't have to forget. You already know. All right. So going forward with that, what can you tell us about the Lifespan Respite Care Program, which supports respite for caregivers?
Yeah. So this is a really interesting program, and it's another great example of why advocacy is so important. So most respite programs exist to serve people and families who have someone who's age 65 or older, or they exist to support families with a child who's in need of special services or supports. And so as we know in the MS community, that leaves a giant gap for those across the lifespan, which is why it's named, sort of from 18 to 65, where those families might need that support and assistance. And so that's where the Lifespan Respite Care Act really comes in. And so it's a federal program that has state implications as well. So it exists as the federal program sets aside funding, and then states apply for that grant funding from the federal government, and the states bring together committees and communities of people to then determine what are we going to use the funding for here? What does our community need? What does our state need to support respite services? So we've seen everything from sort of an online system where people can research a network of support and respite services to direct respite care being provided. So it's really a range as states bring together committees that help decide what that's going to look like.
And the society is just involved with that, helping to advocate for the benefit of the program, correct?
Right. So we've advocated at the federal level for continued authorization and funding of the program, and also in a number of states, to help serve on those committees and to help determine what the state grant money is going to be used for.
Great, thank you. And the reason why I brought this up, because in case people don't realize what's going on, is that according to the MS Society, caregivers of people with MS spend about 24 hours a week providing care. Now, that's a lot of time for somebody to be spending with you, especially that's just 1 week, not per month. So I think it's a great program what the government has and that the society advocates, to get for, providing some respite for, little vacation for those caregivers that are out there. All right. Yes. Okay,
Yes.
good. All right. So next, healthcare and health insurance coverage is so important for people with MS, but we know there's a lot of barriers in the system. Not much transparency, a lack of public information on the price of healthcare services, and people receiving surprise medical bills. What type of advocacy efforts are in place to address transparency of coverage and cost, as well as the surprise bills?
Right. So let's start with the surprise medical bills because we have great news there. So this is something that was included in that end of year congressional package. So it's now law that as of 2022, so it's important to note it doesn't take effect until 2022, that patients won't get surprise medical bills. So if you're not familiar with what this is, it's when you get a medical bill that you weren't expecting, and essentially it's saying that even though you thought you used an in-network provider, so a provider that was covered by your health insurance, you somehow used a provider that's out of network, and so you get a large bill for it. That's a surprise. So it's one of the few things within policy and government that's sort of aptly named. It literally is a surprise medical bill. So, how does this happen for most people, and how might it happen for people with MS? So a lot of times when we see surprise medical bills, it's when you're interacting with an ambulance service or with a hospital. And the reason for that is that you may go to a hospital that's in your network, so it's covered by your insurance, but certain providers within that hospital are not covered by your insurance. And that's because for certain types of providers, it's fairly common for hospitals to contract out for those healthcare services rather than hire those people to be hospital staff. And so this is particularly common within emergency departments and anesthesiologists. We've also seen it come up quite often for pathology services, so lab work and those types of services. So, if you think about it, you might fall, right? And an ambulance comes and you can't dictate where an ambulance takes you. They're going to take you to the closest hospital. And so if you're in an emergency setting, you don't have time to research a hospital. You don't have time to research all the providers in the hospital. Often you would never know what providers you're going to see in a hospital setting anyway, right? So you often think that you're doing everything right. So maybe you're having a relapse for MS and you take yourself to the emergency department. You've looked up on your insurance. You're going to a hospital that's covered by your insurance. But again, unbeknownst to you, that doctor that you see in the emergency department is actually not covered by your insurance. And you wind up getting a large bill several months later. So this was passed in that end of year package that surprise medical bills will not be allowed to be given to patients at the end of in 2022. And so part of what we advocated for was for patients to be held harmless. That means that you are removed from the situation, and sort of the negotiating about who's going to pay that bill and how that happens will happen between the health insurer and the healthcare provider, but you as the patient are removed from that situation. So, in the meantime, in 2021, if you get a large bill, you should research it first, call your health insurance and see what you can do. And if it's really something that you have to pay, or if it's something they're willing to work with you on, or something that they're willing to negotiate on your behalf with the healthcare provider. So, that's another example of something that it became law, and over 2021, we'll be working on what are the details behind it to see how it actually gets implemented. But, that's something that we were hearing quite a bit from people with MS, either due to their MS or other healthcare issues and conditions. And so we're really pleased to see that passed, and that will be a big relief for a lot of people within the healthcare system.
As a whole, sorry to cut you off, but as a whole, how does the MS community, how do the 1 million in the United States learn about this and how they can be assisted?
Yeah, I mean, so it's a great question, Stuart. So, we will put out a lot of information both on our website and to our emails that go out. We share information with the other MS organizations and hope that they're sharing that information out. With something like surprise medical bills, where it passes in 2020 and takes effect in 2022, there's this lag and sort of conversations around what do we let people know now, because we don't want people to think it's taking effect now. It's not taking effect till 2022, but those are some of the conversations we're having around how do we tell people, when do we tell them, and what are the details that we're telling them. The good thing about surprise medical bills in 2022 is that, hopefully that's something that notification isn't required. It's just not an added burden or cost for people, because that's being taken care of behind the scenes.
Great, thank you. I normally wait to the end, but I just lost my feed. Oh, there we go.
Oh.
All right. So somebody just wrote in that her name is Cindy. She says, Bari, were you having to go to the Capitol Hill to lobby all these things yourself? She's just curious. And if so, do you want help?
We always want help, Cindy. So, I have a great team, a small team. So, these days, no one's going directly to Capitol Hill. We're having conversations like this, but, my team is doing a lot more of the direct lobbying than I am. We work with a lot of great coalition partners as well, because we're able to add our voices together. So I don't think it will surprise you to know that a lot of patient advocacy groups were out there advocating to end the practice of surprise medical billing. So we were able to really leverage all of those voices together, which helps as well. But we really rely on the voices of people affected by MS in our advocacy work. So elected officials and their staff would much rather hear directly from all of you, who's also their constituents. I'm not voting for all of these people. I have my elected officials here in Virginia, but they really want to hear directly from their constituents. So that's all of you across the country, wherever you live. And our goal is to make it as easy as possible for you to do that and to join in the advocacy work.
Great, thank you. All right, if we could touch on affordability of and access to MS medications, people with MS report high and escalating medication prices, financial burden due to out-of-pocket costs, challenges navigating insurance to get their DMTs, that's disease-modifying therapies for those that forget. And this is such an important concern for so many. What type of advocacy efforts have made change in this arena? And if you can please share any progress made.
So it's so important to take the time to recognize the progress. So advocacy can really be a long haul sometimes. So we have to, stop and make sure that we're recognizing those markers along the way when we do have progress. So we're not anywhere near we want to be on solving affordable access to medications, but we have made tremendous progress over the past few years. So it's a super complex, complicated area. I know I don't need to tell all of you that, but there's a lot of different stakeholders in the healthcare system. And so, our belief is that every one of them has a role in changing their current business practices and contributing to change to make sure that people can get the medications they need in a way that's affordable, that it's simple for you to do that, and that the processes and procedures around it are transparent for you. So, where have we come? So right now, there's a lot greater awareness of the problems that are facing people with MS. And we see elected officials using the MS landscape as an example all the time. And so don't ever underestimate how important that is in moving the needle forward. So, we've seen some committees talk about MS and use the MS medication landscape as examples, as a class of drugs that they're investigating. So all of those things add data that we need to the arena, but they're also raising huge amounts of awareness and bringing public pressure to bear too. So, all of that awareness as well has really pushed down on drug price increases across the board over probably the last 2 years. So, 5-6 years ago, it was not uncommon to see price increases that were in the double digits for a lot of different medications, not just for MS medications. But we really don't see that anymore. And a lot of that is from the public pressure and the awareness and the advocacy efforts that are happening within drug pricing and access. So we've had also a lot of success at the state level around what we call common sense step therapy. So step therapy, if you're not familiar, is essentially when the insurance is indicating which medication you should try based on how they've tiered the medications. So it may say, well, you're going to try medication A, and if you don't do well on medication A, then you can move to medication B, right? So in some ways that may be okay for some instances. We do have about 20 disease modifying treatments in the MS landscape. So there's certain times, certain formulations, algorithms where some of those types of rules may make sense. But what we know is that for every person with MS, they react differently to every one of the disease modifying treatments. And so those decisions really need to be made by a person with MS and their healthcare provider. And when we say common sense step therapy, we really mean things like, well, you tried medication C, but now you're on a different insurance, so you have to try it again. That doesn't make any sense. We know that medication's not going to work well for you, so you shouldn't have to try it again. If there's medications that are the same mechanism action, they work the same way, it doesn't make sense for you to have to work through all of the ones that work the same way before you get a different one. So those are the types of things that we've had some success about in a lot of different states.
Great, thank you.
Yeah.
So I know you were just talking about this to do with the insurance industry. How does that work for people that are on Medicare? Are there any advantages or disadvantages based on what we were just talking about with these topics that relate to a person that's on Medicare?
Yeah, there's probably advantages and disadvantages being on Medicare. So the greatest disadvantage I hear from people with MS with a high level of frequency is that when someone is on Medicare, you cannot access financial assistance from a pharmaceutical company. You can still access financial assistance from a separate nonprofit entity. There's a lot of demand for those programs, and those programs may cap the level of assistance that they provide. But you cannot get it from financial assistance. That's often a difficult transition for people with MS as they're moving from private insurance into Medicare. There are some rules that govern Medicare. There have to be at least 2 medications per class that are available. There's catastrophic coverage where you're paying 5%. There's a whole separate sort of slate of priority issues we have that are specific to Medicare prescription drug coverage, and those include things like capping the out-of-pocket cost, because right now there is no cap on what someone on Medicare has to pay. So that's one of the biggest ones. There's some things around sort of the benefit design structure that make it really difficult to understand and hard for people, and making sure that there's a robust benefits and appeals process that goes back to some of those core things we've been talking about. It's transparent, you know how to manage through it, you know what the steps are, and you know what to expect in terms of when you'll hear back.
Thank you. When you just said that there is no cap on the Medicare, is that the same that's with the Medicare supplement policies? Aren't there caps there?
So the supplemental policies, I believe they all work a little differently. So, you know, that's something that I'm not sure of right now.
Okay, no problem. I'm going to be making a video on that, everybody. I just had to apply for all that, and oh my gosh, yeah, it's grueling. But I'm going to make a video to make it easier for everybody. So we're going to get that going in the coming weeks.
Okay.
All right, Bari, what do you feel is or are currently some of the most crucial advocacy issues facing the MS community today? And can you share any related updates?
I mean, I am particularly passionate around drug pricing and access. And, you know, I think we have data that clearly says that early and ongoing treatment is the best way to manage your course of MS. And so if we're saying early and ongoing treatment is what you need to do, then we need to make sure people can get the treatment that they need, move to a different treatment if necessary, and be able to afford their medication. So, you know, I'm particularly passionate about that area. I spend a lot of time on access to medications. But, you know, I think overall, really anything within the healthcare space is just so critically important for people with MS to get what they need to live well.
Okay, thank you. Last question before we go to the virtual, because we got several virtual. When I say virtual, people ask questions when they registered, and people are asking questions now when they're online as well. So the last question I have before we get to that is, can you please tell the audience how someone can get more involved in advocacy efforts?
I would love to. And this is where you may want to look at that handout.
Yes.
So we see, I helped you out there, Stuart.
You did.
So we have a few things listed on the handout. So there's ways that you can join the MS Society's MS Activist Network. And so that is our network of activists. It's an online network. So if you sign up for that, you will receive a monthly newsletter that gives some highlights each month. You will get notified of urgent actions that you need to take to move legislation forward, either at the federal level or in your state. And you'll learn more about the upcoming virtual public policy conference, which will be held in March. We also have a MS Activist Twitter account, so you can sort of follow our activities and information there, and that's at MS Activist.
Great, thank you. So for everybody that saw it come up on the screen, it's not that it's gone, all right? It's still there. So if you click on the handouts, you can print it out, all right? Or, you know, if you need to, you can contact us after the program and we can email it to you as well. But it's easiest if you just click on the handout and print it off yourselves, if possible. And if not, like I said, it's on the side right. I was just told by my video producer to tell you that, all right? It's down there on the right side, you know, underneath one of those boxes there that either questions or handouts or whatever's there. Just click away, all right? All right.
Yeah.
Thank you, Bari, for doing this. Now let's get into some of these other questions, all right?
Yeah.
So let's say somebody online wrote earlier, how does the National Multiple Sclerosis Society interact with the ADA? This was written by a Jill.
Right. So, we're coming up on the 30th anniversary, right? I think of the ADA. So, you know, we've been involved. We sort of weighed in at the beginning around the passage of the Americans with Disabilities Act. We've been active in the past as there have been sort of amendments to the ADA. You know, we work with coalition groups on making sure that sort of the standards and intent of the ADA is being upheld. And sometimes, you know, other things pop up that are related to the ADA. Within the last few years, there was a big move around airline transportation that was sort of tied into some of that. And so we were active within that. But, we want to make sure that the intent of the ADA is upheld, and we join some of the celebrations every summer as we come up on that anniversary at the end of July, and hope that people are benefiting from the ADA. And if you run into trouble, we'd love to hear that too.
Okay, thank you. All right, next is from Tamara, or Tamara. I'm sorry. I don't know which way to say your name, all right? I have relatives say it both ways. Okay, how are DMT prices coming down or stabilizing when my copay nearly doubled this year? I paid $140 for a 3-month supply. This month I was charged $230 for the same 3-month supply.
Yeah. So first, I'm sorry that you're experiencing that, and it speaks to the complexities within the system that are just not okay, because you should know why that's happening. We should all be able to understand exactly why that's happening. So, so first, to clarify, the prices are not coming down, right? The price increases are lessening. So there's a difference, and it adds to the complexity. So there's the list price, which is sort of what's known as the price out there, and then the price increases that most companies will take every year, though not all. Those are reducing in the increases that we're seeing. Then companies work with, and sometimes there's other middlemen involved, so it really does get complicated. But essentially, there's a negotiation with a pharmacy benefit manager or a health insurer, and oftentimes a pharmacy benefit manager manages the drug formulary, so they manage the prescription drug benefit directly for an insurer. And they're having negotiations around what they're going to cover on the prescription drug formulary, what the rebates are, so how much that insurer is going to pay for the medication, and it gets impacted in terms of where it's placed on the formulary for you to access it. So if your copay has directly increased from a previous year, there's probably a few different things that might be happening. So one is your copay just changed, and maybe you have a coinsurance, or maybe you moved from a direct copay, which is a flat amount, to a coinsurance, which is a percentage of the cost of the medication. It could be that your medication is now on a higher tier within a formulary, and that comes with a higher cost share for you as the patient. So it's hard to know, just from that description exactly what's happening, but it's not okay that you don't know. And that's why we really are so involved in advocating on these issues related to access and affordability of drugs.
Okay, and then Cindy writes, are some of the prices lessening because they've become generic as well?
Yeah, so it's a great question, Cindy. So again, a really complicated landscape. So what we typically don't see is a price reduction of a list price. So what we will see when there's a generic for a medication is that we don't see any more price increases for the brand of the medication because there's a generic available. Sometimes often there's greater reductions happening behind the scenes in those rebates because there's a generic available. What we've seen in MS, and we're fairly new to generics within MS, but we have sort of a category of what I call specialty generics. And that means that our generics are still really expensive. So specialty drugs is a weird terminology that's given. It comes from sort of the Medicare system, where a specialty drug is really anything that's expensive. It's above a certain price point. So, we've been trained over years to think that generics are super inexpensive, they're pennies. That's not true with the MS medications, right? So when a generic medication first comes on market, it's typically 15% less than a brand medication. So the prices of the MS medications, the brands, range from about $65,000 to about $105,000. So even when you see something that's 15% less, you're still talking about a medication that's going to be over $40,000 a year. And so, we have been hearing over the past few weeks as we entered into January, there is a generic for an oral medication now. So people are seeing that show up on their formularies and they're having trouble affording it, even though it's a generic, because it's so expensive still. So we have a lot of awareness still to do in this area with a lot of elected officials and policymakers that still are used to hearing generic means inexpensive and affordable. And so, again, it's complicated, but we want to hear the stories from people that are having challenges affording their medication, because it helps us talk to elected officials about the problems that are out there.
Okay, thank you. How will we meet and be addressing issues that are usually addressed at the MS Public Policy Conference in our new world when living with COVID?
Yeah, so we are taking the Public Policy Conference virtual. So I'm excited and terrified at the same time, I'll be honest with you. So it will be different. And we're working through that now. We have an exciting platform to do the public policy conference with that we think is going to provide a lot of opportunities for interaction and engagement. And the really exciting part is that we're going to be able to open it up to a lot more people than we could when it's in person, right? When it's in person, we have, hotel size and restrictions. There's some cost constraints, but by doing it in a virtual space, we can invite a lot more people to be part of the public policy conference in some way. So those plans are happening. They're underway. And if you're part of our MS Activist Network, you'll hear more about it pretty soon.
Great. I look forward to getting into that as well, too.
Yeah.
I need to get in there, right? I can help generate more interest maybe for it. So, all right. What financial help is available for needed equipment?
So, there's a lot of different services that are out there. The National MS Society does have MS navigators that can help people connect to the resources that are going to best help you and support you across your MS journey. So we have a phone available. If you hop on the website, a chat feature will pop up and you can talk with an MS navigator there who can help you find the resources that you need.
Okay, thank you. All right, next, of course, we have questions from people who are using different MS therapies that are considered immunosuppressants. All right, and they want to know why they cannot get listed to be high risk so they could get vaccinated at any age. I'm hearing from people that are in their 30s, 40s, 50s, 60s, all right? How does it get them? Can they have a better shot at getting vaccinated sooner?
So as you might imagine, we've been spending quite a bit of time talking about this, right? And here's my disclaimer again that I don't have a science background. The MS Society does have guidance out around the vaccine, where our expert group is currently working on guidance around DMT timing along with the vaccine, and that should be out within the next couple of weeks. So I do encourage you to sort of check back on the MS Society website for that. So now to the specific question around sort of prioritization for the vaccines. So the Centers for Disease Control, the CDC, has a special commission that has developed the prioritization. It's a very complicated area. There's a lot of need, as we're seeing already. There's more need than we have vaccine available. And even within the great job they did in setting up the phases, there's some ambiguity in there. And we have sent comments and questions to the CDC committee to try and clarify for people with MS. It's also important to note that the CDC sets guidance, but then every state is developing its own prioritization using the guidance as a basis for informing their decisions, but it's going to look different state by state. So a couple of things that are a little maybe not as clear as we would want them to be that we've asked for clarification on within that phase 1C guidance, which is that group that's 16 to 64 with a high-risk medical condition. There is some terminology around neurological conditions. The CDC guidance seems to further use some examples of dementia and ALS within that. And then there's also a phrase around immune weakening medications. So it's unclear as to whether some of the MS medications might fit within that immune weakening. So again, we have asked for clarification. We have not heard back yet. So, there's the CDC guidance, and then every state is doing it differently. So I know I've talked to people in some states that depending on their state, they've been able to get the vaccine or sort of register to get the vaccine. Oftentimes, it's, in their state, they could indicate they had a neurological condition and then they were not asked further questions. In some states, you might be asked more questions if you check that box. So it's not a great answer because it varies so much state to state, but you really do need to look very carefully at your state or county health department and look at sort of the questionnaires and the phases that they have to see if you might fit within there. Even if you don't meet their qualifications based on MS, really take a look because there may be other indications or high risk conditions that are called out that you might fit. Diabetes, smoking in some places, obesity is listed, high blood pressure. So even if it's not your MS, you may have some other conditions that may qualify you.
Yeah, like being over 60. Hoo-hoo. And yet, you have to be over 65 to be vaccinated. I feel like a kid again, not old enough.
There you go. You're a youngster.
Right. Yes, exactly. All right. So Michael is writing, I became classified as a permanent disabled and have SSDI status. Does that fit in a high level for COVID vaccine?
I can't say for sure, Michael. I don't believe I've seen that anywhere, but again, you would want to look at your particular state's health department to take a look.
Okay, thank you for answering, Michael. And Cindy's writing something. This is that same Cindy again, so you get to say hello to her again. She writes, we need to be higher than a 1C, exclamation point. I don't know what that is. I appreciate all the advocacy that can be done, so she's just letting you know that, okay?
Okay.
All right, and then Pam Morrissey, another more kudos, I guess. Thank you for advocating for MS 20,000. How can we see where those funds are being spent?
Oh, so it's 20 million.
20 million, there you go.
20 million. And so it's called, the umbrella program is the CDMRP. So it stands for the Congressionally Directed Medical Research Program. And I think we probably have something on our website, but I think you can also Google the CDMRP for MS or the MS Research Program in the Department of Defense. And they do put out a really nice program book that describes the research that they've been funding. The other great thing about this program in particular is that it has a consumer reviewer component to it. So people with MS are actually part of some of the groups that are sort of setting the direction for the program. So deciding on the types of research that the program will solicit funding requests for, and even on some panels to review the research and provide recommendations.
Yeah, thank you. It's gotten extremely loud in here because we're having a major rainstorm. So I don't hear everything. I'm sorry. And I also did see there was a tornado nearby recently. So that just came up 20 minutes ago. All right, going further, how can we get our voices out to Congress?
Yeah, join the MS Activist Network and, look up your elected official on social media. They're there. I promise you, they're paying attention. So let them know what you're thinking.
Okay, next one. I've relocated to Maryland. I believe it's Maryland. How can I be an advocate during COVID-19? What will happen to and with MS Awareness Month, or the week when all the chapters would come together and go to Capitol Hill for a week in March? For Annapolis Day, is there ways to advocate during C19?
Yeah, so the other item that's on the handouts that I forgot to mention, see, I'm getting like you, Stuart, is our state action days. So those are also happening virtually this year. So the timing for all the state action days is different based on the state and what's happening in the state legislature. The Virginia Day just happened earlier this week and was a big success. The Maryland one is coming up. So take a look on the handout and there'll be a link for you to find out more information about state action days, and you can drill down and find out more about the Maryland days specifically.
Great, thank you. Bruce just wrote, does advocacy or personal emails work better for getting Congress's ear?
We're in a different environment, right? So, there's a lot of organizations that looked at the best way to have impact, and, it would be in person followed by some other things, right? In person doesn't happen. So I think however you can connect with an elected official is the best way to do it. And that personalization piece is really just critically important. So whether you're, a lot of elected officials are having town halls too. So whether you join a town hall and talk to them there, send them an email either through the MS Activist Network or on your own, but just take that extra moment or two to personalize it, make it a little different, stand out, tell them what living with MS means for you and what policies you need to live your best life with MS. Just let them know that. So that personalization is really going to go a long way.
Okay, thank you. There's a question here that you probably wouldn't know anything about, but I'll ask you anyway. Is it that the COVID doses are running short in supply, or is it the syringes that are running short in supply?
So I'm not involved deep in conversations, but I have heard it's a little bit of both.
That's what I've heard too. All right. Next and last one that I have for you is, where or to whom should we send letters to help us pay for our very expensive medications?
So this question could be getting at a few different things. So if you're looking for financial assistance to help you right now, contact an MS navigator and they'll help you work through different options for you. If you want to let your elected official know how challenging it is for you to be able to afford your medication, you want to look at your direct elected official, so who you're a constituent for, and you have a House member and 2 senators in Congress. And then you can also, if you're even further motivated, look at sort of the leadership, so chairs and ranking members of committees like a health committee. They have different names in the House and Senate, but it would be Energy and Commerce in the House, the Senate Health, Education, Labor, and Pensions Committee in the Senate. So the chairs of those committees and the ranking members have a lot of sway over what those committees might do.
Okay, thank you. And I do have one more question. It's sitting here right before my face. How is advocacy different from activism?
Yeah, so they can be interchangeable. I think sometimes we think about it a little like Emeril, the chef, activism kicks it up a notch. So there's just a little more, we like to think of it as a little more passion, a little more energy, making sure that we're really leading with the voices of the community. And that sort of defines how we think about activism at the MS Society.
Okay, great. So a few people wrote that you are awesome.
Oh, you guys are awesome. You're all going to tell my kids, right? I'm going to go tell my kids that you all said I'm awesome.
Well, the good part about this is that you can show your kids, because in a few days from now, this is going to be on our YouTube channel. So anybody that's here and you want to share it with your friends, your family, or whatnot, you can. And Bari could share it with her kids just so she can show off to them and say, hey,
That's
other
right.
people think I'm awesome. Why don't you guys say it to me? All right. But I do want to thank you for being with us tonight. It was very good. I'm glad that we were able to get through all the questions. And if anybody else has any questions for you later on, are you okay with me sending you their questions?
Yeah, absolutely. You guys can also find me on the Society's website. If you look under the leadership page, you'll be able to find me there too. So
Great.
reach
Great.
out. There's also an MS Activist email. So msactivist@nmss.org.
Great. Thank you for that. And
All
now, of
right.
course, I got different people writing in different things, but yes, they want to know that you're great and that woohoo, we're going to keep this going. All right. Thank you
Yeah.
very much.
Thank
Thank
you,
you very
Stuart.
much. And
Thanks for
I'll
having
speak to
me.
you. I'll speak with you soon. And again, thanks
Yeah.
for everything. You're awesome.
All right. Bye,
All right.
everyone.
Thank you. Bye-bye.